When combined, these four seeds offer a holistic approach: hemp seeds for testosterone and NO, celery seeds for magnesium and hormone regulation, pumpkin seeds for zinc and endurance, and pomegranate arils for rapid NO enhancement and circulation. Together, they target the pillars of vitality in men over 60. Small, consistent dietary habits often yield the biggest transformations. Start small, add a seed to your morning smoothie or snack bowl, and watch how your body and energy respond over time. Your body can heal and rebuild itself, and it's never too late to begin. Drop a comment sharing which seed will you try first, or what natural remedy has already made a difference for you. I read every comment. Your journey could inspire another man today. Thanks for being here. Take care and step into your best self. The foreskin shields the sensitive glands from constant friction and environmental irritants. Think of it as a natural sheath designed to protect one of the most delicate areas of the body. Function 2. Lubrication. The inner surface of the foreskin helps maintain moisture and a balanced environment around the glands. This can contribute to comfort, especially during sexual activity. Function 3. Sensation. The foreskin contains thousands of fine touch nerve endings. For many men, it plays a meaningful role in arousal and pleasure. That said, foreskin removal or circumcision has been practiced for thousands of years, and in recent decades, the conversation has moved toward medical reasons. So, let's look at the proven health benefits of circumcision. 1. Improved hygiene. A circumcised penis is generally easier to clean. Without the foreskin, there's less risk of smegma buildup. That's the thick, white substance made of skin cells and oil. While not dangerous, poor hygiene can lead to odor, irritation, and infections. 2. Lower infection risk. The space beneath the foreskin can trap moisture and bacteria. This can increase the risk of vaginopostitis, inflammation of both the foreskin and glands. Circumcision, especially in infancy, also significantly reduces the risk of urinary tract infections in the first year of life. 3. Reduced risk of sexually transmitted infections. This is where the science is strongest. Large randomized controlled trials, published in journals like The Lancet, found that circumcision reduces the risk of HIV transmission during heterosexual intercourse by up to 60%. These studies also showed a significant decrease in the transmission of HPV, which can cause genital warts and cancers, and herpes simplex virus type 2, which causes genital herpes. Why? Because the inner foreskin is thin, non-keratinized, and rich in immune cells that viruses like HIV target. Removing this tissue removes a vulnerable point of entry. Now, it's important to be clear. Circumcision reduces risk, but it's not a substitute for safe sex. Condoms remain the most effective protection against STI. 4. Reduced risk of penile cancer. Although rare, penile cancer is linked to chronic inflammation, poor hygiene, and HPV infection, all of which circumcision helps lower. But of course, no medical decision is one-sided. Let's talk about the risks and disadvantages of circumcision. Like any surgery, there are risks, especially if not performed in a sterile professional setting. These include pain, especially in the immediate healing period, bleeding or infection at the incision, sight, aesthetic concerns, too much or too little skin removed, rare complications requiring revision surgery, and the most often discussed downside, reduced sensation. Because the foreskin contains nerve-rich tissue, removing it does change the sensory experience of the penis. Over time, the now exposed glands can become slightly less sensitive due to keratinization, a natural thickening process. Some men report no noticeable difference. Others say it reduces their sexual pleasure. It's a subjective experience, but one worth considering. You also lose the natural lubrication and protection the foreskin provides, which some men find important for comfort or arousal. Now let's talk about when circumcision isn't a choice. It's a medical necessity. The most common condition is phimosis, when the foreskin is too tight to retract. Mild cases can often be managed, but in severe cases it can cause infections, hygiene issues, or painful erections. Even more serious is phimosis, when the foreskin is retracted and gets stuck behind the glands, cutting off circulation. This is a medical emergency. Chronic infections that don't respond to creams or improved hygiene may also require surgical intervention. Outside of those scenarios, circumcision becomes a personal decision, one that may depend on your cultural background, health beliefs, or sexual preferences. In summary, the foreskin has biological value. Its removal offers real, scientifically supported health advantages, but it also carries risks and permanently alters the body. There is no one-size-fits-all answer here. It's a personal, medical, and often emotional decision, and it deserves thoughtful consideration. If you're experiencing discomfort, tightness, or recurring infections, or if you're simply unsure, talk to a urologist. A physical exam, a conversation, and a clear explanation can help you make the best decision for your body. And if you're watching this because you're thinking about overall sexual health, not just circumcision, but things like performance, sensitivity, and confidence, I've linked to a fascinating free video below that explores a natural, science-backed method for restoring blood flow and function without pills or invasive procedures. Check the pinned comment if you're curious. If you found this video helpful, please give it a like. Subscribe for more fact-based men's health videos and share it with anyone asking the same important question. I'm Dr. Rotker, Katherine Rotker. Thanks for watching and take care of your